Good morning.
Good morning. I was just trying to get the lighting right because I've got the sun either right in my face or it's a little bit dark.
But you're wearing red. So for the 1st of December, I feel this is an appropriate look.
Well, I was like you, I had black on yesterday because it was a grey, miserable day. So I had black on, and yeah, today it's a little bit festive, a little bit more cheery.
I did wonder if we should start with a Christmas song this morning just to get us into the spirit.
Oh God, are you going to sing?
And then I thought, well, I'm not going to sing it. I don't think Kirsty is, so probably.
I don't mind a sing song. I'm not shy, but I have to have had a drink first.
If there are any willing audience members that want to come on and give us a little Christmas intro, then you're more than welcome.
You never know. People are feeling a bit doolally at the moment, aren't they? So we need a bit of something to cheer us up.
I can't believe it's the 1st of December. I remember about 8 weeks saying, oh, I'm not celebrating Christmas until the 1st of December. Like, I'm not putting my tree up. I know a few people were talking about doing it early this year. Yeah. But since now the 1st of December, how did that happen? It feels like it went by in just the blink of an eye.
I know, and a lot of people are putting them up early, aren't they? So I don't know if you have, but we've put some decorations up just because I think people need something a little bit cheery and a little bit, upbeat and something to look forwards to. So, it's nice.
Yeah. So we should have got a Christmas tree for the background.
Well, yeah, I'll arrange that for next time. Well, you're professional. You've got a proper Lynton background, whereas I've just got my bedroom. All you can see is my nice duvet and the drawers. Hopefully, we know Nick is hanging out.
I'll tell you what I have got.
Oh, that's really good. How have you done
that? If you just go into the video filters in the Zoom chat, then in the Zoom video section, you can put them on.
Oh God, you've thrown me.
We do know we're live, by the way, audience, if you're wondering.
Yes, I know. We are messing around. Oh, this is
right. Now I have to get it off. Hang on. There we go.
I thought that was a good look. Oh, I can see them. I just can't see a Christmassy one. Oh, I see it. Yeah, I forget there's an audience because I can't actually see anybody. I forget there's people listening.
Well, we do. We've got quite a few actually ready to go. So shall we get started?
Let's get started.
I think that we've mostly Lynton customers on today, but just in case you're joining us, not from Lynton, we're Lynton. My name's Hayley and I'm the Sales and Marketing Director, and I'm joined today by Kirsty, who is a long-standing member of our clinical team, a real expert when it comes to laser and IPL, and she's currently our clinic manager and is heavily involved in the training courses that we run, of course, from the Lynton Training Academy. So over the last year or so, obviously during a lot of the lockdowns, we've been running lots of different webinars on as many different topics as we can think of, really, business topics, clinical topics. You can find a whole host of them up on our YouTube channel. So if you just go to YouTube and Google Lynton Lasers or put Lynton Lasers into the search term there, then you'll come across a lot of our webinars. So Kirsty today is going to be talking us through how to treat skin of all colours, how to make sure you get excellent results without or reducing the risk of any complications as well. So that's the focus of today. So very shortly, I'm going to hand over to Kirsty to run through that. But I'll just take a small moment to mention that next year we are launching a brand new product. It is all about skin rejuvenation, but at a very, very deep level of the skin, a level of the skin we haven't ever treated before. So this doesn't clash with any of your existing treatments. In fact, it complements your existing treatments because it gets deeper into the skin. I'm not going to talk about it too much because we're keeping things a little bit under wraps. This is a machine which is going to be exclusively available for Lynton customers for a set period of time. So if you want to get ahead of the competition in your local area, then do please get in touch with us if you're interested in bringing in something new to the business, because we've got something new and exclusive. We're looking for a set number of Lynton clinics to actually work with us on quite an exclusive launch program for this particular machine. So the first step in that is going to be a virtual launch event, which I'll be hosting very soon. If you're interested, drop me a line, I'll put you onto the guest list, and there are limited spaces available. So my email is just hjones@lynton.co.uk, and I'll put that into the chat function in a moment so that you can jot it down if you'd like to be involved. And then I'll hand over to you, Kirsty.
Fabulous, thank you very much. Okie dokie. Right, so good morning everybody. So I'm going to share my screen first, and then we will work our way through. So this is a topic that is, I think, very important, and certainly we get asked an awful lot about Fitzpatrick, something that I'm very passionate about, and I really try to highlight in training how important it is to try and get this right. And really, there's not just one method of doing this, you know, there's a few methods that should be involved. So one thing I see a lot of is people just using their visual skills only. So looking at the skin and deciding what skin type they are. And the danger of doing that is that you won't always get it right. So we're going to talk a little bit about Fitzpatrick, a little bit about different skin types. And then, as Hayley says, just a little bit on, you know, different sort of wavelengths, you know, how you can use those on different skin types and what skin types are suitable for, and a little bit of an overview of the different treatments. And also we're going to look at the illumiFacial as well. So trying to keep it a bit consolidated, because obviously I know people, while she's still off, people are busy, and I'm sure you're ramping up and getting raring to go to open your clinics tomorrow. So we'll get started. So we're going to start by looking at the Fitzpatrick scale. And some of you that don't, might not know, Fitzpatrick scale is something that was developed by a chap called Thomas B. Fitzpatrick, no surprise, and it was developed in 1975. And this was originally devised to look at how different skin types cope in UV light, essentially. And so what we know is that, again, somebody may look very fair. So if you look at the different skin types at the top, you might have something like an oriental skin, for example, which looks very fair, but actually if you put that oriental skin into the sun, actually it responds very differently to how a very pale Caucasian skin would respond. So one of the things that we will look at in a second is ethnicity, because we know that plays a big part. So just saying, well, why do we use it in aesthetics? I'm sure most of you who are working with IPL lasers understand this and know this, that obviously a lot of the time we're working with devices that are absorbed by melanin. And if we get too much absorption, we'll actually get a negative impact. And we could unfortunately get a hypo, pigmentation, or of course we could get a burn as well. And actually, even the wavelengths that aren't absorbed by melanin, so some wavelengths are absorbed by water. So sometimes in that situation, people say, well, you know, Fitzpatrick doesn't really matter. Well, it does, because whatever sort of, you know, absorption you're working on, you're still generally putting a lot of heat into the skin. And darker skins don't like heat, you know, sort of as much, or they react more to heat. And they react more to trauma as well. So even if you're doing a skin needling treatment or, you know, a really strong peel, we know we've got to be a little bit more cautious with these skin types. So we talk about sometimes melanin being a problem, but actually, you know, it's not necessarily a problem. In fact, you know, we have it there for a reason. We have it there to protect us. And actually, you know, it's incredibly clever. It's very much like hair. It's there to protect you. And it's there that, you know, when the sun particularly comes out, the melanin will absorb the UV and it will protect you. So it's often described as little umbrellas that pop out on the beach. So you go into UV light, your melanocyte cells go into sort of overdrive, they're quite stimulated, and they start to produce more melanin. So it's a clever thing, it's a good thing. Some people want more of it. So typically fairer skins often say, oh, I wish I could be tanned all the time. Some skin types want to be lighter. And I guess we all want an even pigmentation that we think looks aesthetically pleasing. So looking at, so this is a sort of characterization of the melanocyte cell. So you can see that it has this sort of like central body with these funny little arms coming off, which are called dendrite arms. And so what we know is that when, again, you go into something like UV light, or you put on an IPL laser, sometimes those melanocytes are stimulated and activated. They can also be stimulated by hormones. So for example, pregnancy, your body wants to protect itself. So again, they become stimulated. And for some people, it can be medication related as well. What we know then is that the melanocyte is stimulated for some reason. And in that stimulation, lots of melanin, which is those little sort of yellow globules there, are produced. So more are produced, and then they are delivered up the dendrite arms, and then it goes into a melanosome, and then that gets transferred into a keratinocyte, and then it will just work its way up potentially. So we know that for some pigmentations, like a tan, for example, it's temporary. We know that melasma, hyperpigmentation, can be temporary. Once the initial stimulation is taken away, often it will calm down. But in some situations, it's permanent. So freckles can be somewhat permanent. Birthmarks can be somewhat permanent. So it just depends on what we're looking at. There are two types of melanin as well. So there's eumelanin, which, as you can see by this picture, is more of a brownie, sort of darker pigment of melanin. And there's pheomelanin as well, which is more your reddy blonde. So one of the things that we talk about when we're looking at hair removal, you know, with lasers and IPLs, is that we want enough eumelanin in that hair. Because if there isn't enough in there, or there's very little, there's not enough to absorb that light. Pheomelanin, which is very reddy blonde, will absorb very little light. The same can be said for freckles. So if you look at freckles, you'll notice that on more of a gingery sort of red-haired person, their freckles can be more like that. So they can be more pheomelanin dominated. We also know that in a darker skin, not surprisingly, these people have got more melanin and they've got more eumelanin. So this is one of the things that I do talk about an awful lot in training, and I still see people not getting it right, if I'm being honest. So I keep going on about it until they get it there. So I say, okay, there's 3 things that you should be looking at when it comes to Fitzpatrick. The first one for us should be ethnic origin. So I put here family heritage just because some people don't actually understand what that means. But what that means basically, where is your blood from? Where are your genetics from? Where are your parents from? Where are your grandparents from? Perhaps you don't know. In that case, that's fine. We'll work with that. But if they do know, it can be really, really helpful. Because again, what we know is that if somebody is originally from a sunnier climate, their skin will have more melanin in there. Even if it doesn't look like it does, they will. So I know in the Lynton clinic, we have had some very, very fair Asian skin types, very, very fair Oriental skin types. And I know some people that would treat those as a skin type 3, and I know some people that treat those as a skin type 2. It's always a judgment thing, but one thing I would always say is they are not a skin type 2, even if they look like they are, because again, if you put them into the sunshine, no sun cream, they will respond differently than a Caucasian skin type 2. So we must look at this first. Then we ask this question. I find that a lot of people aren't great at answering it actually. So what you find is a lot of Caucasian skin types, for whatever reason, will say, well, you know, I don't actually burn that easily in sunshine. So I think what you've got to say is, look, imagine you're in strong sunshine, you've got no SPF on at all, you know, surely you go red. And normally at that point they'll say, oh, well, yes, I go red. Yes, yes, like the top picture. Oh, yes, I go a bit red, yeah. But then I go, you know, tanned, then I go darker. So sometimes it's just that they don't understand what we mean when we say, you know, a burn. So sometimes you've just got to be a little bit more specific. Sometimes you've just got to take their answer with a pinch of salt. I've had lots of very fair skin types say that they don't burn. I'm sure you've had it where you've had a lot of fair skin types that have ticked the form and gone themselves as a Fitzpatrick 5, and you're thinking, you're definitely not a 5, you're a 1, you know. So just bear that in mind, but always ask this question. It's very, very relevant. And then obviously, by all means, use your visual skills, use your eyes, have a look, you know, we should always be doing that. Have a look at the colour of the skin. And I'll talk about this in a couple of slides' time, but also look at the different areas. So one thing that we really focus on in training is that you're not the same colour all over. I mean, you might be, but a lot of people are not. So we need to factor that in as well. But we need to be looking at things like eye colour can be helpful. Hair colour, yes and no. Obviously, a lot of people colour their hair now, but if we can find out what it is naturally, that's also very helpful. You know, and just factoring in all the different sort of features, really. So this is something that you will have seen before, I'm sure. Particularly, we always factor this into our training. And what hopefully you all know is that the safest, if you like, skin type to treat is a skin type 1, and therefore the riskiest is a skin type 6. That said, one thing that we're going to look at in a second is how we get round that. So how do we get round treating the darker skin types? Sometimes we can easily, and they're very, very treatable. Sometimes we can't, unfortunately, and we have to say we can't treat you with our equipment. It's not possible. So if you look at this, you can see that basically skin types 1, 2, and 3 are mainly sort of Caucasian skin types, or as you start to look at skin type 3 particularly, possibly 4, you start to factor in more your Southern European, so Mediterranean skin types. So I tend to put a Mediterranean skin as a skin type 3, possibly 4 if they're very dark. Even within a country, if you look at Spain, northern Spain, typically they don't see as much sun as southern Spain. So if you're good with geographics, you can sort of make that, you know, distinguish the two. If you're not, don't worry about it. Hopefully, you know roughly where they sit within, you know, the world. So then what we say is that an Oriental or a very fair Asian skin type could be possibly a 3, possibly a 4. I tend to personally never put an Asian skin type as a 3. I personally always go for a 4. And if they're a darker Asian skin type, maybe more of an Indian skin, I would go for a 5. Lastly, a black skin or an Afro-Caribbean skin, we would go for as a 6. Even with these methodologies that I'm talking, you know, about now, don't get me wrong, I don't think we can always get it 100% correct. You know, it's quite common where I'm thinking, well, you could be a 2, you could be a 3. You know, you look like a 2, but you sound like a 3. So even people who've been doing these treatments for years are never 100% sure. And so what we always teach is if you're not sure between 2 skin types, go for the darker skin type. It's always safer. The settings will be lower. It might mean that you then actually can't use that wavelength, which is obviously not what we want. But again, we've got to make, you know, a safe decision. What we don't want to do is obviously go too safe, if you know what I mean by that, or too cautious. You can't be too safe, but you can be too cautious. So if you think somebody's a 3, but you're umming and ahhing, you put them as a 5, or you just get it wrong, you know, you're just not familiar with this, then you are going to end up potentially under-treating. So we don't want burns, we don't want problems, but we also want good results as well. And sometimes what we'll do is we'll start treating them on a skin type 3, and we'll increase our settings. So we might do this in the patch test, or we might do this throughout, you know, a course of treatments. And once we're at that highest setting for that skin type 3, what we might do then is turn them down to skin type 2, using the same fluence, but normally the pulse, the delivery of the light will be faster, which means it's a little bit stronger. And then you can go up to the maximum settings on a skin type 2. What we don't then do is turn them down to a 1, because obviously that's a step too far. So it's just a case of trying to get the balance and trying to find that kind of what we call the therapeutic window. If somebody's mixed heritage, it can make it a little bit more challenging, and you've got to be a little bit more careful here, because I know I've met a couple of clients where they've got mixed heritage. So for example, they've got a grandparent that's a skin type 6, and by the time it's filtered down to them, they're actually really fair. If you looked at someone like Jade Goody, if you remember who she was, she looked incredibly fair, but actually she had a grandparent that was a skin type 6. So again, if you didn't ask that, you would put her probably as a skin type 1, when actually really, if you asked about her heritage and you also asked about how easily she burnt in strong sunshine, you'd probably end up putting her possibly even as a 3. So it's got to be, you know, a compromise and a balance between them all. These are quite good. So for anyone that really wants more clarification or wants to really try and ensure they get this, you know, absolutely bob on where possible, you can use a questionnaire. So I know some people that do this, and essentially it's like a point scoring system. So they'll get so many points for, you know, a paler skin, so many points for hair colour, eye colour, and it kind of works it out for you. And they're fairly accurate, a couple of the ones that I've worked with, and they're worth certainly being aware of. And that just sort of reiterates really what they're looking at and what they're taking into account. Certainly whenever you see freckles, as we know, that tends to indicate a fairer skin. Again, you could get someone like the previous picture showed where they're mixed heritage. So actually they're quite dark skinned, but they've got freckles, which is unusual. So you wouldn't always see freckles and think skin type 1, skin type 2. It's not as simple as that. But typically freckles are associated with skin type 1 and 2, and therefore where has that come from? So I was saying before, are we the same colour all over? Typically, as I say, well, theoretically we are somewhat, but it's very common that we will be darker in certain areas. So it's very typical that areas like underarms, groins, sometimes around the mouth area, around the eyes, areas again where basically we need more protection, we will have more pigmentation. So the one thing that we try and reiterate in training is make sure that you don't just give the person a Fitzpatrick skin type, you give the area as well. So it could be that their underarms are a skin type 5, but actually the rest of them is a skin type 4. It could be that if you're doing, say, a full bikini line, like a Hollywood, for example, the outer part, the standard bikini line is a skin type, you know, say, well, 2, let's go with. But the inner parts, you know, as you get further and further in, tend to have a little bit of pigmentation and might be a skin type 3. So this is something that you need to pick up in your consultation and pick it up in your patch test. People can be quite nervous when it comes to patch testing, and they can be quite cautious. So sometimes they'll just test a small little bit and just a little bit there, and that's it. Again, we train the opposite really, in that we say, well, again, with that bikini line, if you've got 2 different skin types, that should be, you know, tested twice. So test on the outer part as a 2, test on the inner part as a 3. That's a thorough patch test, and you're less likely to have problems by doing that than only doing a little test on the outside and then they get burnt on the inner parts. The other thing to say about this as well is that, you know, certain areas, like I know my arms are darker than my torso because my arms see a lot more sunlight, you know, over the years. And eventually you can end up with a bit of a permanent tan. You know, if you go into the sun enough, your skin will hold colour for a long, long time. So it could just be that actually they've had quite a bit of sun exposure. It's not recent, because obviously we know we can't treat in that situation, but it's old. And again, we need to just adapt. So I'm a classic skin type 1, very fair, burn easily, but my arms actually are a 2, even sometimes a 3, you know, even when they've not seen sun for a long time. So I sort of touched on this already, but it just reiterates, but at the same time, I'm careful how I phrase this, because one thing we don't want people to do is be scared of treating these skin types. So I had a course on the other week and someone was saying, oh, you know, I'm just so scared of treating these skin types. The point behind technology now, this is what we're going to start looking at, is that if you're working with the right wavelength in the right way, the risk of problems should still be low. You know, the risk is always there with whatever you treat. And some clients are at higher risk, like darker skin types, and some are at lower. But there's always a risk and there's always a way to manage that risk. So looking then at what wavelengths are suitable. So there's lots of wavelengths, actually. There's lots of systems out there. I didn't want to talk about them all just because of time. And I didn't want to sort of spend, you know, too long talking about every single one. But the common ones that I know certainly a lot of you will have is, if we're looking at hair removal, what we tend to say is that a lot of you will have the 650 handpiece. It's an IPL system. Now that one is actually suitable for skin types 1 to 5, which is fantastic. It gives you a really wide range of people that you can treat. So what that means is that unfortunately you can't treat a skin type 6, so you can't treat a black skin, but everybody else you can treat potentially. So real, sort of wide range there. Obviously we have to be careful, and we'll talk about the technology that's in there that helps you to be careful. The next one is an alexandrite laser. So we have got both of these actually at the Lynton Clinic. And alexandrite lasers used to be called the gold standard in hair removal, like the very, very best you could get. Technology's moved on, and don't get me wrong, there's now wavelengths that compete quite nicely alongside the alexandrite. But the downside to it being so effective, so good, is that it's not suitable for dark skin types. So the melanin absorption by an alexandrite is a lot. Melanin will really love this wavelength. Some people will treat a skin type 4 with this. So I put 1 to 3. Some will do a 4. And if I'm being very honest, I will treat a light 4 with alexandrite. So a very sort of fair Asian skin type. Because what I find on that skin type is that I treat a lot of Asian skins for facial hair, particularly, women. And I find that although the hair is black, it's very, very thin. And that's a challenging hair for all of us to treat. Trying to get the settings high enough to work on the thin hair, but not burn the skin is not easy. And so I've learned by, sort of dabbling and changing my settings that I can treat a light 4. But I'd only do that if you're experienced, if I'm being honest. So looking then at the other 2 wavelengths, again, there are more, but there's a diode which typically operates about 8-10 nanometers. So we sell a diode, we sell it you can use in a standard mode or a pain-free mode. So it depends how you're operating that as to what skin type you can treat. But as you can see, you can treat up to potentially really quite dark skin types. The absorption by melanin is much lower, so it's much safer. And then the one that's always been deemed the absolute safest is an Nd:YAG 1064. So actually this can be used on skin types 1 to 6. It says 4 to 6, but it can be used on everybody. The melanin absorption is much, much lower, which is what makes it so safe. But again, this is where there's a couple of myths, I think, out there, a couple of misunderstandings, because some people have got IPL and they've got an Nd:YAG. And what some people say is, right, I'm on treatment number, let's say 6 now. The hairs are thinner, so I'm struggling to get as good a result. So I'm going to swap to my laser. I'm going to swap to my YAG. I, as a trainer, would say, no, don't do that. Unless you have to because of skin type, don't do that. Because actually the YAG is less absorbed by melanin, as we know, and so it's going to be harder to get a good result on that hair. So actually stick with your IPL. And just keep on increasing your settings where you possibly can. Keep on tweaking pulse and delay and trying to get the very best sort of settings that you can. And to be honest, we all get to the point where we're struggling on that last bit of hair that's incredibly fine. That's very normal. So for pigmentation then, one thing that we really focus on a lot when we're training is, well, what pigment are you trying to treat? I'm not going to talk about it too much now just because of time, but it should really be only solar lentiginous, so freckles, age spots, sunspots. That's the pigmentation that we recommend you can treat. If you're working with a Q-switch laser, you can also treat a cafe-au-lait birthmark. There are other birthmarks, but again, we don't generally always recommend treating them. There's a couple of others, but just to keep this simple. So make sure you are treating the right pigmentation in the first place. That's a big one. And then look again at what wavelength you're working with. A lot of you will have the 585. And again, I've put their skin types 1 to 3. Now, some of you might be sitting there thinking, well, hang on a minute. I got told I could do a 4. Well, I do treat a 4. We're not saying you can't do a 4, but what we're trying to get across is that if you're going to consider it, maybe do it when you're a little bit more experienced, but also what type of pigmentation is it? Skin type 4s are not prone to freckles, age spots, sunspots. They're prone to hyperpigmentation. And again, just be incredibly cautious. Make sure, it's an obvious thing to say, but make sure the pigment really is darker than the skin. If what you're treating is not darker, you shouldn't be treating it no matter what the skin type is. So that's why I put skin types 1 to 3. If any of you are working with a Q-switch laser, you might have 532, 1064. You may even have 694 or an Alex. But just again, to keep it simple, I've just put that Q-switch 532 is a really nice option. Again, skin types 1, 2, and 3, because there's a really high melanin absorption. Sometimes we get asked, you know, well, I've got an IPL and I've got a Q-switch. Which one do I use? And what I always say to that is, it depends what you're treating. The easiest way to explain this is that if the pigment you're treating is really pale, Q-switch can work better. It's stronger, and the melanin absorption's a little bit more. So it's really pale, Q-switch is a great option. If it's got a bit more colour to it, so it's more like a caramelly sort of, you know, bordering onto a toffee sort of colour, then IPL works incredibly well. So we tend to use IPL in the first couple of sessions, let's say, and then we move on to Q-switch as it gets paler, or in the beginning it's pale, we start with Q-switch. Sometimes it's just one lesion and we just get the Q-switch out. You know, sometimes it's just a decision on the day. Q-switch does leave a little bit more downtime. It can leave a little bit of bruising. So we have to be aware of that as well. And then lastly, for any of you that might have the Alexandrite wavelength, we would, again, skin types 1, 2, and 3. And this can be a nice wavelength to be used on pigmentation also. So looking at vessels, the main couple of options that I'm guessing most of you have got is either, again, the 585 or the Nd:YAG 1064. Now, it's not surprising to see that I've put 1, 2, and 3 again for IPL. Same explanation as pigmentation. It's too risky, in my experience, to treat a 4. You know, I know people that have. I've tried it, but it is very, very risky. And again, mainly the sort of conditions that we can treat: broken thread vessels, rosacea, spider nevi. They are more prone in a Caucasian skin type or a lighter skin type. The one thing that can confuse some people slightly is that where I put Nd:YAG is only for skin types 1 to 3. Some people think, well, oh, that's a bit confusing, because I thought Nd:YAG could be used on up to a skin type 6. It can for things like hair removal. It can for things like collagen stimulation. But with vessels, we use such high settings, otherwise it doesn't work, that they're too high to use on a darker skin type. It would be too risky. So again, if you want a simpler life, 1 to 3. If you like a bit of a challenge and you like to live life on the edge, maybe try a 4. And it depends what you're treating. If you're treating a Campbell de Morgan and you keep it literally on that Campbell de Morgan, then you could argue that, you know, you shouldn't have too much of a problem. Obviously, IPL, the blocks are a little bit bigger, and so then you can end up treating more of the surrounding skin. You can always, if you want to, try and get like a white eyeliner, which you should all have anyway, and actually colour around. So say you've got a Campbell de Morgan or you've got a freckle, you can actually colour around it with white eyeliner, just so that you're only targeting that specific lesion. Or you can actually get a white cotton pad, you know, dampen it a little bit and cut a hole out. So that's a good technique if you're considering doing a dark 3 or a light 4. Then lastly, collagen. Well, the good news is there's a wavelength for everybody, and we know that all wavelengths, as long as you put some heat into the skin, will stimulate collagen. So actually all devices generally stimulate collagen. It's just that some are better than others. So here, again, going back to IPL, which I know a lot of you have got, we would again keep the 585 at skin types 1, 2, and 3. So shortly, I'm going to talk about illumiFacial, and you know, what is you've got to be aware of the illumiFacial is that you can use 650 and 585, or you can just use 650, or you can just use 585. So when it first came out, the protocol was 650 followed by 585, but you don't have to do that. So, you know, if you've got a darker skin type, you can still do the illumiFacial. So 585 is often known as the better wavelength for rejuvenation. A lot of people say, oh, I don't bother with 650, I just use a 585. 585 does not stimulate any more collagen than 650 does. They'll both stimulate collagen very, very well, or fairly well, you know, fine lines up to medium lines, slight slackness. There are some wavelengths that are better. But the reason why people deviate to this one so much is because it also, obviously, we know, works so well on vessels and pigmentation as well, so photo rejuvenation. So you'll see some of our pictures with the illumiFacial, and it is true that for a photo damaged client, 585 is fantastic. It's amazing. But if you only want to stimulate collagen, your 650 will do it just as well. It is less risky on darker skins and also old tans because the melanin absorption is lower. So that is the one that we would plumb for on a darker skin. But also, if you just don't need the 585, so if people haven't got photo rejuvenation, why use a riskier wavelength? You don't need to. Equally, if that's all you've got, it's absolutely fine to do that on the right skin type. Alexandrite, going back again, we can treat, I've put 4 here, just because we don't need to use as higher settings to stimulate collagen. So you could potentially go up to a skin type 4, but again, just be careful. And if there is some pigmentation in the area, you know, freckles, sunspots, age spots, obviously Alex can work on that at the same time. So again, photo rejuvenation. And lastly, Nd:YAG. So a lot of people don't actually even think about using this necessarily for collagen stimulation. It works incredibly well. And actually, you could argue that it might work even more than something like an IPL because it's got a longer wavelength, so a deeper penetration. So some people actually favour this and find they get slightly better results. I think it's subtle, but I think it's worth knowing about. And of course, we can use this on our darker skin types and anyone who's got an old tan. The one thing that we always say is in the months when the sun is somewhat shining, i.e. spring and summer, we do not particularly like using that 585 too much. It's an excellent handpiece and it's powerful and we don't want to have problems. So we're always quite cautious. So looking then, and that list is not exhaustive, by the way, there's lots more. I could talk all day. Anyone that knows me knows that I never shut up, but obviously I wanted to keep this to roughly an hour. So you know, if anybody wants to know more about other things like fractional you know, lasers or whatever else, obviously you can ask afterwards, or we can have a chat another time. But now thinking about, well, whatever wavelength I'm working with, how can I treat, you know, more safely but still get good results? So obviously ensure skin type is correct, as we talked about already. Obviously ensure that you are working with the correct wavelength. That's really, really important. As I'm sure you all know, the darker the skin, the lower those fluencies will be. But it's not necessarily making it less effective because it's all about absorption. So on a low fluence, you can still get a high absorption. This is one thing that I know confuses a lot of people, even people that have been doing it for years, but I'm going to explain this. There's a picture that will come up shortly. But just to make this simple, the longer that you deliver light over, the weaker it becomes. So people always think, well, if I put my light on for 50 milliseconds, or I put it on for 20 milliseconds, the 50 milliseconds must be stronger because it's a higher number. It's not. The longer you take to deliver an energy, the weaker it is. So in training, we always talk about punching. You know, if I had a certain force in my shoulder and I punch someone really quickly, it's going to have far more impact than if I punch them slowly. And so it's just trying to get your head around that really. But, you know, most machines are somewhat preset and also there's parameter charts as well. The other thing that you could think about is just working more slowly. So if you're doing hair removal and you've got a laser, you could maybe slow it down. But even with IPL, you know, you can only go so fast with IPL, obviously, but it might just be, you know, just being a little bit more cautious. Particularly with laser, I'd say this is more aimed at laser. If you're working with an Alexandrite or YAG that can fire at, you know, 4 hertz, fantastic. But if you're not careful at that speed, you might do more overlapping, and that's a problem for a dark skin. We've also got to think about cooling. So one thing we say for all skin types is you shouldn't need to do much pre-cooling. As long as they're body temperature or cooler, that's fine. But if they're not, a little bit's good. But certainly a bit of cooling during and definitely afterwards. So we had a model on the course the other week, one of the students, Asian skin type. She had a patch test on her leg and on her arm. And she said that, well, it feels quite warm, you know, and we said, well, yeah, that's fine, you know, and the settings weren't high. The settings were something like 16, well, we went up to 16 joules, 5 pulses, 50 delay. The next day she came into training and she had, the whole area was red, swollen. There were no specific block marks, so it wasn't sort of like the start of a burn, but it was red and it was swollen. She said it feels quite warm. So, you know, first of all, we hadn't noticed that straight away because she's a darker skin type. And secondly, when she mentioned it, lots and lots and lots of cooling. The more you cool, the more you obviously take down that risk of skin problems. A day later, she was absolutely fine, by the way. She does react to things. She is known to have a bit of an urticaria type reaction to things. And obviously ensuring that they have been out of the sun for, we always say at least 4 weeks. But for anyone that is naturally a bit, you know, darker, we will say, look, you've got to be out of the sun for longer, because one, you pick up the sun better and you hold your colour for longer, and two, you're already a bit riskier to treat. So we're going to wait longer. So instead of waiting 4 weeks as a minimum, it should be more like 8 weeks as a minimum. And wait as long as you need to as well. Don't be afraid to say to your client, I'm not prepared to treat you yet. You still look too dark to me. So this is what we're talking about. So this is, I say this and I mean this truly, that this is why Lynton's equipment is honestly so good, because they've studied this for years. You know, as a lot of you know, they're physicists, and they've really looked at the pulsing, and so the delivery of light, how long it should be on for, how long it should be off for, how many pulses. It's been studied a lot. And in the 12 years or so that I've been with Lynton, it's been changed as well. So that the original luminers have been changed. And more recently, this dynamic reflex technology was sort of released, and it's all about getting sub-millisecond pulses. So really short pulse durations that can mean that you can get some really strong, powerful results. But equally, if you look at these two pictures, what we always explain is when you're looking at an IPL and you're looking at pulse and delay, if, for example, you had, let's say 20 joules, if you put 20 joules over this first image, what you've actually got, if you've got two pulses, so you've got 10 joules in one and you've got 10 joules in the other. So you've not got two lots of 20, you've got 20 broken into two. In the sort of gap, as it were, the bit in between, nothing's happening. It's called a delay. So basically it's on for 10 joules, then it's off, then it's on for 10 joules. So that's quite a powerful way of releasing light. But if you look here in this explanation, you can see that the pulsing is much more. So if you took 20 joules there, for example, in each pulse, you would have 4 joules. So 4, 4, 4, 4, 4. And then in between, it's off. So they often refer to this as a train. These are the carriages, and you can look at how long the whole thing is on for. So in training, I know a lot of you have been on our clinical updates, and what we always say is, I always ask the question, which is the strongest? Is it the one on the left or is it the one on the right? And I always get mixed answers, which, you know, is interesting. So the answer is the one on the left is the strongest, because again, the quicker you deliver light, the stronger it is. So if you're looking at our IPL machines and you've got fluence and you've got pulse and you've got delay, you increase fluence, it's stronger. You increase pulse, it's weaker. You increase delay, it's weaker. So it's just about understanding that machine. And again, just working with your parameter charts. The parameter charts are really good and they're really accurate. And again, I'm sure you've all seen this, but it's just worth reiterating that in this example, what we're just trying to demonstrate is that when the first pulse of light goes in this situation, we're trying to treat hair, obviously. So the hair will absorb, it's nice and black and dark, but also so will the melanin in the skin a little bit. So we just give a very short off time, just enough to let the hair cool, the skin cool down, but not the hair. And that again is the difference, or one of the differences, when you're looking at good quality equipment. They've studied this, they've got it right. So we know that you should be getting the good results that you need without hopefully any damage to the skin. So that's a bit of an overview there on Fitzpatrick and various wavelengths. I just then wanted to talk to you about illumiFacial, because we get quite a lot of questions about this. I know quite a lot of you have got it. Some of you might be looking at taking it on. So you can just see there all the products that are involved. So you can see that those are the products that you require to do the illumiFacial. And of course, you need a machine as well. So it's using the IPL in combination with the products. So before we talk about the specifics, I'll just show you a couple of pictures. I've not put too many in this, again, just for time. But this is one that my colleague did at the clinic, which is fantastic. She got really, really good results here. Now, this particular client was treated only with a 585, no 650 at all. And the reason why my colleague decided to do that, and I completely agree with her decision, was because if you look at her skin, I think, there you go, you can see that she's got quite a lot of photo damage going on. So quite a lot of pigmentation. And if you look really closely, you can see she's got some vascular damage as well. So my colleague kind of said, well, you know, surely the 585 all over. And I said, yeah, absolutely. You know, she's a fair skin type, so you know that you can do it safely. And so we'll talk about treatment technique in a second, but just so you know, she did a complete pass with a 585, and then any little ones that didn't pick up as much as she wanted to, she went back over with a small block on higher settings. You can see there she had 4 treatments and they were performed roughly every 4 weeks, and brilliant results, really, really excellent. She was really delighted with that. And she went on actually to have more treated. I think she had her hands, she had a neck, she had a décolleté. She was really, really pleased. This one then is a lady that I treated that she's only had one, but you can just about see that she was quite vascular, quite ruddy complexion, and she had broken vessels as well. And in the after picture, I always think it looks a bit like she's got makeup on, but she honestly hasn't. I took those pictures myself. That was her skin. We saw a really good difference. And I haven't put on there actually, which I apologise, but just to explain, again, she was treated with only 585. We didn't use any 650 on her. So what is it and how does it work? So it is essentially, what it is a combination of a fruit acid peel that is performed before the IPL. And this, to be totally honest, is not a new protocol. This protocol actually has been around for years. But what was identified, particularly by marketing, was that for whatever reason, a lot of clinics are just not utilising this. Maybe they're fearful of the concept of the peel before. You know, the problem as well we found was there's so many different types of peels out there. So, you know, what peel can be put on before and what peel can't be, you know, and that's where it became very difficult actually. And it is using our IPL. So I know some customers have got a long pulsed Nd:YAG. I know some of you have got other wavelengths. That's not to say that you can't consider this protocol, but it wouldn't be technically the illumiFacial. And you wouldn't do a peel before something like a fractional laser and ablative laser. That would just be, yeah, dicing with death, I would say. Although I know people that do. So this is primarily using our fruit acid peel, which I don't know if I put a slide in actually about it, but I'll just tell you now that it's 20%, it's glycolic, tartaric, malic, and it's got a little bit of a BHA, it's got a little bit of salicylic in there. It's a pH of 3, which means it's not too acidy, it's not too powerful. So it's a gentle AHA peel, but it's, when I say gentle, it's still got enough in there to essentially remove any dead skin cells that sit on the surface. So what we know about dead skin is that it just sits there and every day it sloughs off, you know. So you look at dust, you know, on your carpet and wherever, and some of that is just your skin. It's designed to, you know, fall off every day. But some people's skin cells don't come off as freely as they should, particularly as we get older. And particularly with something like an oily skin, oil acts like glue and sticks your skin cells down. And most of us, to be honest, you know, would benefit from having some of the dead skin cells, some of that corneum taken away. Just by doing that, your skin will look fresher. So you don't have to do this protocol. You know, you might have this package of products and you might sometimes only do a peel. That's absolutely fine. That's what we do in our clinic. We'll do a course of Illumi, but then every month or so we'll get them back for just a peel, and then maybe every other time we'll do an Illumi on them. So a peel on its own can be amazing. But a peel on its own obviously doesn't really do a lot for, you know, pigmentation, or not truly. So what we do is we put the peel on first and then we follow it with the IPL. Now, as I say, if you read this protocol here, it's saying a full face or full, you know, pass, one pass of 650. So typically medium block, and you're just going to do one pass. And the one thing that we always say is you must patch test. So just because it's a facial, you're still using IPL, you're still using something that could cause problems. So you must patch test. And normally if I'm patch testing a face, I will patch test the forehead and I'll patch test the cheek as well. And I'll normally put a little bit of the peel on the side as well, just to ensure that they're okay with that. So what you would do in your patch test is ensure that you increase the 650 until the point where the client says, oh, I can definitely feel that, you know, no more than a 7 or 8 out of 10, but yes, I can feel heat. It's the heat that stimulates the fibroblasts that then go on to make collagen lasting. And the more heat you can get in there, the more collagen production you will get. So in the standard illumiFacial, it would be 650 first, and then 585 with a small block, just where you've got a few vessels and a few pigmentations, and you go straight over. But as I have said a couple of times already, if you don't have a 650, please don't think you can't do this protocol. You absolutely can. You would do your first pass with a 585 instead of the 650. It just means that you can't treat, unfortunately, skin type 5, and 4's risky, maybe a light 4, but I'd stick to 1 to 3. So you can absolutely still do this protocol. Clinical results, essentially, as you've seen, you know, you will have a much sort of potentially sort of smoother skin, obviously. So that's the peel. The peel itself will smooth the skin out. It'll hydrate it, but also it'll be more uniform in colour. So as you saw with those couple of ladies there, much more even colour, less visible pores. So people are obsessed with pore size, and it will reduce the size of the pores. And also what some people don't realise is that it's also good for reducing breakouts as well. So again, illumiFacial, people get into the head that it's only for people that are aging. It's really not. It's for people who suffer with breakouts. It's for people who have you know, open pores. It's very much geared up to be like a photofacial. So instead of putting on your like Snapchat filters and all the filters that everybody uses, you are having, you know, an illumiFacial. And lastly, it can also be really good for congestion. So anyone that's got a build-up of oil and congestion, it's brilliant for. The peel will obviously work into the pores and work on the congestion, particularly salicylic, which will work into the pores. But also we know that IPL helps to reduce the size of the sebaceous gland. We know it helps to kill bacteria. And we know it also reduces inflammation as well. So it's many skin types. There's not many skin types basically that can't have this. The only people that may not have this is someone who is highly sensitive, you know, particularly towards AHAs. For example, a really, you know, a severe rosacea, for example. So severe rosacea may use IPL, but you might decide not to use the peel, you know, so anyone that maybe struggles a little bit with that. The explanation is then that a good explanation actually that someone used with me the other day, and I thought, well, that's a good one, I'm going to use that, is that it's a bit like when you've got dirty windows. So your windows are dirty and the sun can't get through, you know. So if you clean that window, get all that dirt and debris off, the light can shine through. So you're taking off the dead cells to let the light penetrate better and deeper, plus you will just get a better overall result. The one thing that you've got to explain to clients is that obviously when it comes to collagen, it's not instant. So sometimes people have this treatment and instantly their skin looks fresher, smoother, softer. That's the peel, and also that's a little bit of inflammation and a little bit of tightening actually from the IPL. But that will only unfortunately last, you know, 2-3 weeks, and then their skin may start to sort of, you know, not look quite as fresh as it first did. And of course, if we treat pigment, it'll actually look, you know, worse before it looks better. But what we're waiting for is the fibroblasts to produce collagen elastin and for it to really kick in. So I would say it's a bit like you go to the gym. You know, you go to the gym 1 or 2 times and you sort of feel like, oh, I don't feel really good about myself. I did a good workout, but you don't really look any different, unfortunately. So it's only as you go several times that the muscle fibers start to grow and expand and that the real work kicks in. So it's the same with this. If you're trying to stimulate collagen, then it takes time, and best results will actually be seen 4 to 6 months later. It's not, as I say, completely instant. Obviously, vessels and pigmentation, as you know, will work quicker. So protocol is, for those of you that are not familiar with it, we use the Lynton cleanser first, which is a beautiful cleanser. It's a nice, creamy, milky cleanser. It gets makeup off amazingly. The stubbornest of makeup, it will shift. So what we tend to say is 2 cleansers with that, 1 to remove makeup, 2 to ensure the skin is completely clean, completely ready. We'll then take our fruit acid peel. We'll often, for example, in our clinic, we'll just use a little plastic pot, and we'll either use a disposable brush or some gauze and saturate it in the peel, and then we'll start to apply it. Normally when I'm applying a peel, I'll put it on the most congested area first, or I'll often start on the forehead. The forehead, regarding a peel, is actually quite tough skin. So I tend to start there first and I apply it to the outer part. The last place I tend to apply it is the sort of T-zone area here. That's always called the danger triangle. If you're going to have anyone react to a peel, it will be there, and also sometimes around here. So I tend to apply that last, but apply it quite quickly. Apply a nice even layer. Avoid the eyes, obviously, and avoid the lips. You can even put some like Vaseline on. Set your timer, and it just depends on what treatment number that you are actually on. So for us, if it's treatment number 1, we tend to say only leave it on for 3 minutes. If it's treatment number 2, you can consider 5 minutes. And if it's 3 or above, you can consider 7 to 10 minutes. Obviously, just use a little bit of common sense. Some people don't need it on for as long as that. Some people have got a finer skin or a more sensitive skin, actually, you know, won't tolerate 7 to 10 minutes. It's too much. Sometimes that stinging that you get with glycolic acid, people can feel that and feel a bit uncomfortable with it. I mean, if that occurs, what we tend to do is just work the spatula over the skin or the brush, because that helps just to calm it down slightly. But that's the procedure. So don't jump straight into 10 minutes, you know. I remember I always tell a story that Sam Hills put the peel on, and she's not used to doing things like that. And I think she left it on for about 10 minutes and then was really quite flaky all around there. So it proves that it's a good peel. You know, it's not an enzyme peel, it is an AHA peel. Lastly then, well, when you decide to take that peel off, whatever time that is, you want to neutralize it. We don't use a neutralizing agent. Cool water is enough. That will neutralize it. So nice cold water using mitts or sponges. And what I would do is do it several times. The neutralization of a peel is really important, and hopefully a lot of you are aware of that. You should always be neutralizing a peel properly, because if you don't, it's still working and the acid is still going. Eventually this peel will self-neutralize anyway, but you want to neutralize it at the time that you've decided. So go over several times, or certainly a few times, you know, make sure that you feel like you've done a good coverage. And to make sure, we are also advising that you do a cleanse afterwards. So at this point, doing another cleanse with the gentle cleanser is a good idea, just to make sure. And the last thing just to say is, does it feel like it's really tingling anywhere? A mild, fresh tingling all over is good. But if somebody says, well, actually, yeah, my top lip's still burning or stinging a little bit, do it again. Because the next step is, of course, our IPL. So you do not want to put in IPL or large amounts of heat on when you are, you know, if you've not neutralized your peel properly. So IPL goes on at that point. You would then, once you've done your IPL procedure, plenty of post-cooling, particularly if you use the 585, particularly if there's been a lot of pigment or vessels in the area, plenty of post-cooling, check with them, so how does it feel? And then once you're satisfied with that, you can remove the treatment gel. Make sure you move it properly as well. Don't just wipe it off, because it's not a gel that sort of goes into the skin nicely like Light Soothe does. It can feel a bit sticky and tacky. So you might even want to do another cleanse, you know, just to make sure. Because then the next step is to apply a nice thick layer of the Lynton Light Soothe. We simply then just let it absorb into the skin, which it will do. Any remnants, you know, that haven't gone in can just be, I mean, it says remove it. I don't remove it generally. I actually massage it into the skin, but most people's skin will absorb it in. If you've not done too much vascular or pigment work, you can actually do a very light massage. So I will just do a light, gentle little thing, you know. When you say the word facial, people start thinking, you know, relaxing, panpipes, and obviously it's not that sort of facial, but if you can make it a little bit nice, then obviously you can do. Lastly then, we're going to put on normally 1 to 2 pumps of your stem cell serum, and finally, really important, your Light Protect, your SPF. So it should be a nice facial protocol. Anyone that's been in our clinic will know that we have this nice mood lighting. So at the beginning and the end, we have the mood lighting on, we have the nice relaxing music. And then of course, when we do the P and the IPL, bright lights are on, it's a bit more clinical. but essentially it's a nice procedure that if you're doing full face should take around about 45 minutes. Obviously, you do other areas, it could take a little bit longer if you include neck and include collet. It's gone down really well in our clinic, and it's really interesting actually, because you know, you lose that sort of foresight of being a client, and you lose that vision of what they see. So as soon as we started promoting illumiFacial, the amount of clients that said, oh, what's that new facial, you know, whereas it's a procedure that we'd been somewhat doing for a while before. But I think as soon as you use the word facial, people's ears prick up. So just to confirm, last couple of slides then are, you know, I've said it time and time again, but I just want to reiterate, it can be done with both hand pieces, or it can be done with just one. So if you only have a 650, that's fine. It just means you can't target vascular lesions. If you only have a 585, that's absolutely fine. It just means you can't treat skin type 4s and 5s. And obviously you have got both, then consider when to use the combination. And lastly, how many and how often? So some people do it as a one-off, but it's not really designed for that. It's not a facial in that way. You know, it is meant to be a course of treatments. So we always sell ours in 3s. We always say if you buy 3, you will get 10% off. And it is a package, so you do need to consider that. What we would say is that for a young client or someone who is more concerned by photo damage, 3 will be enough. But if it's actually someone who wants more collagen stimulation, or they've got more of a complex issue, so they've got acne, which is a tricky one, or they've got rosacea, you tend to find you might need more treatment. So you might need up to 6. You might say, look, buy 3 and let's see how far we get you. You know, it's you can always do that. And then treatment spacing, as an average, is every 4 weeks. If it was mainly for acne that you're targeting, you might do it a little bit sooner. You might do it every 3 weeks. I wouldn't go down too much more, because obviously you are doing a peel in it. And if it's pigmentation and someone takes a little bit longer to heal, you might want to stretch it up to 6 weeks. And it's fine to stretch it up to 6 weeks for collagen stimulation or vessels or pigment anyway. And then maintenance, because obviously we never stay the same every day. Things change all the time. We're aging every day. So one thing I try and really get across to our clients is that this is not permanent. You know, at some point, the vessels and pigment will probably reappear. Acne, rosacea can be ongoing, as we all know, and collagen definitely should be maintained, because as those collagen levels increase, they will then peak, and then unfortunately they'll just come back down again, because obviously we age every day and we lose on average 1% collagen every year once we hit 25. And for a lot of women, particularly as we hit menopause, that tends to speed up a little bit. So we tend to say to our clients, look, we want to see you again. I like to see people in an ideal world every 4 to 6 weeks. So that might just be for a peel one time and the next time illumiFacial. If they can't commit to that for financial reasons or whatever, I say, look, that's okay, but I do need to see you every 3 months, you know, just to keep it ticking over. But we're always encouraging people, and we're always planting that seed that this is an ongoing thing. Going back to that gym, you know, you don't just go a few times, you know, you keep on going. This is a lifestyle change. And maintenance is really important. Okay, so that's the end of the presentation. I'll draw breath now, because I haven't done that much throughout it. So I will just stop sharing my screen. And I've seen a chat box actually has been, let's have a little look. Let's have a look.
Hi, Kirsty.
Hello. I'm just looking at the chat box to see if there's anything.
Yeah, so someone asked a question about fractional lasers, the fractional resurface, and the can they use it on all skin types?
So the answer is yes, you can. So it can be used up to a skin type 6. It's just, again, even though it's absorbed by water, when you're treating dark skin types, there is a little bit more risk associated. So just be a bit more cautious with your settings. It might be that you only use 1 pulse to start with, or 2 pulses. Patch test is always a good idea. So maybe just do a little patch test, you know, around the side somewhere. And if you're really worried about, if you think it's someone who's prone to problems, like an Asian skin type is prone to hyperpigmentation, you could use melanin suppressant products for about 8 weeks before. So, you know, giving them some products, saying you must stay out the sun, you know, explain it's not a procedure to be done if they're going to be in a lot of sunlight. But yeah, we've treated quite a few. I've treated quite a few 4s and 5s, certainly.
Yeah. Okay, good. And Christina was asking about using the peel followed by ND YAG on a skin type 5 and or 6.
Yeah, so that's not something I've personally done that I can think of. That's obviously a little bit more, isn't it? That's a bit more risky. I mean, I would personally say it is considerable, but I just would literally leave your peel on for 1 or 2 minutes and then just see how you go. And I'd work your way up very, very cautiously. So I think it's not out of the question, but I wouldn't leave that peel on for very long.
Yeah, I think it's sort of balanced out by the fact that the YAG is all water targeting really if they're using it in a rejuvenation setting. So you'd expect to just get quite deep, mild heating with that, wouldn't you? So should be okay. But as Kirsty says, just take it easy.
The other thing I would say is that maybe just don't do the peel on the same day as the laser. So if you sort of think, well, they need a bit of a stronger peel, really, just do the peel and wait at least a week before you do the laser. Because even though the lasers, less absorbed by melanin and a bit more water, it's still putting a lot of heat into the skin. And that skin type, if you're putting acids on and then you're putting heat on the same day, it might rebel and not like it.
Okay. So Paulina said she really loves the illumiFacial. She's had really amazing results with it. Her question is that recently she had a lady who was a skin type 2. She had freckles all over and she'd had them forever. She did an illumi with a 585 for pigment. Some of them picked up nicely. She used a small block to top up the darkest ones. So that was it. After 4 weeks, she said she'd not had much flake off and she doesn't see a difference. So should she continue with more treatments every 4 weeks or maybe go to the stronger fractional?
I think what I would say about that is that if the pigmentation is not going darker, then obviously it's not working. And sometimes what happens is if they're quite pale, they'll go a little bit darker, but not a lot, and then they won't flake. So if it's not doing it properly, then there's no point just doing more and more treatment because the same thing's just going to keep happening. So if you can't increase your settings, if you're at the absolute maximum, then you might be a little bit limited as to how far you can get there. But the other thing is that always, so I say this cautiously, but I'll say it, it's not out of the question to do a cheeky third pass. If it's quite a fair skin type, to say in fact, no, let's play this the right way. So say you've done 650 all over and then you've done a second pass with a 585 small block. After say 2 or 3 minutes, the darkening will have occurred more, obviously. But if you think it's not enough, just doing the odd little second pass again, so effectively a third pass, is not out of the question. So it might just be, if you can increase your settings, obviously do. If you can reduce your pulse and delay, pulse can be considered to be reduced by 1, delay by 5 or 10. But maybe just another very cautious pass on a few of them is not out of question. Fractional, no, because whilst fractional does reduce pigmentation, in my experience, it doesn't reduce it as well as IPL. So I personally try and stick with IPL.
Yeah. Okay, great. Just worth pointing out as well that you're not limited on, with the alexandrite, when you were talking about wavelengths earlier on, that you're not limited to just skin types 1 to 3 if you're using the Moveo technology.
Good point. Yeah, good point, actually. Yeah, absolutely. Yeah, Moveo is the unique one, isn't it? Where you can, because it's the pain-free mode and it's a lot gentler, you can easily treat darker skin types with it.
Yeah, so if you've got the alexandrite, then you can use, as Kirsty says, traditionally you are restricted to the lighter skin colours, but when you've got the Moveo technology, you can treat all the way up to a skin type 6. It's FDA approved for that, so you can use that to treat all skins that you come across.
It was a weird one to get your head around, that, wasn't it? I know when we first launched it, because I worked with Alex for years, then someone said, you can use the Alex now up to skin type 6, and I was like, what? But then when we looked at the technology, very clever, and it is, I've used it, is completely
it's
safe.
Groundbreaking. So it is a bit, it goes against what we know from history, but that's technology, isn't it? It's disruptive technology. It comes along and new exciting things can be done.
Yeah, absolutely. Yeah.
I think that's it for questions, unless if anyone has any last questions, please do drop them into, I can't see any more. I don't think we've missed any.
The last one was saying it's helpful, which thank you, because obviously you never know when you do these webinars what people know and don't know, and I didn't want to go on and on and on, but if anyone's got any other questions, obviously you can always drop us an email, and it's no problem for us to chat with you.
Yeah, no, really good feedback, Kirsty. I think that was on point. Seems to have gone down well. Someone said these webinars are a godsend.
Yay. I think I said to Chris and Martin the other day, a bit cheeky, I was like, God shall speak and people shall listen. I think that's gone to your head a bit there, Kirsty. Fab, good. All right, well, thank you, and thank you for everybody's attendance. It's the last day where we're all stuck at home, and hopefully everyone's back in the clinics tomorrow or Thursday.
Yeah, good luck, everybody. I hope you absolutely smash it in December, and you're full to the brim with customers. And if you're not, then check out our portal, where we've recently put in over 200 social media template images for you to use for your socials. We've got pictures in Instagram sizes, Facebook sizes, with text, without text, so you can customize them. And of course, we've got that 365-day social media planner as well. So there's lots of tools in there. And we will be running a coffee morning for Lynton customers on the 18th of December. That's at 10 a.m. So if you're looking for maybe some ideas to spark your January, February, March, that will be a good coffee morning to just block out of your diary now. So we'll talk in there about different things that you can be doing January, February, March to drum up some business if it's a little bit quieter as we get over into 2021. But hopefully, fingers crossed, you'll be having years worth of demand all ramped up, ready to come in.
Well, also just lastly to say as well that have a good look at the training courses that are on next year. I'm just literally about to put new dates in for some new courses. So we're just about to release some new masterclasses. So skin rejuvenation masterclass, body shaping, and also fungal nail warts masterclass as well. So there's some new things coming next year. And if you haven't attended one, attend the clinical updates, because they're really good and they're free to most people. So if you're on a service contract or you're still in your lease period, then they're normally free. So there's loads of help out there, more than there ever has been.
Yeah. Worth noting for the fungal nail and verrucas, anyone that's got a YAG can do that, can use their YAG, can't they, for those indications?
Yeah, absolutely. Yeah, exactly. That's what it's about, really utilising the system as much as you can. Not everybody will utilise it in that way, but it's worth knowing that you can.
Yeah, perfect. Right, okay. Thanks ever so much.
Get on with the day. All right then.
Have a good day, everyone. Thanks ever so much. Thanks
Everyone.
Bye.
Take care.